In this video, we will demonstrate how to set up your VF3 or VF3 Pro headset stand along with some best practices. Place the adjustable arm inside the center of the base and insert the included Allen wrench into the hex key hole. Turn the Allen wrench to the right until it's tight. Screw the headset attachment into the adjustable arm. Align the headset buttons with the cutouts in the stand and press the headset firmly until it feels secure. Use the adjustable knob to rotate the headset so that it faces upward toward the patient at an angle. Do not rotate the headset parallel to the ground, or else the stand may tip over during testing. If needed, use the center dial to adjust the stand height. Before starting an exam, ensure the headset is facing up and is adjusted to the correct height. Cue an exam on our website and explain to your patient how to use the clicker. Finally, have your patient lean into the headset and position themselves so they are comfortable and the screen is clear. For the most accurate results, the patient should press their face into the headset so there is no light leaking in from the top or the sides, and the technician or doctor should dim the lights in the room. And now, you're all set.